That's the big thing.
That's an incredible
Pay my
thing.
bill then.
No, Mike, you have to.
Maybe I shouldn't even say that, but I mean, that's an incredible feature to have, that they can go through some tough times and still be able to weather through it.
Yeah.
That's the whole point.
Got a cushion.
Mhm.
Yeah.
Well, I think they're really important to this community. So,
Oh, it is.
you know, just
And-
my own experience, I've gone to the clinic you can go and you can walk, you know, they'll get you in and,
Heck yeah.
you go to Billings, it's like, we'll see you in 2 weeks, or go to the emergency, that's the other thing I always just get, just
Yeah,
go
you
to
got-
the emergency room. Doctor
Exactly.
can't see you.
Just
You
like
know-
when
Go ahead.
Edwin went up there to we took him.
Yeah.
If I'd have known, I'd have just taken him to Roundup, but I wanted him because it is connected with Billings Clinic, but I thought, well, let's go to Billings so that if he gets sick again, he'll be able to go right to Roundup, they'll have his records.
Right.
We had to go to the emergency room in Billings, and he was there for 6 hours, and there were people coming in and out of there. One of them was, there was a gunshot, there were some major accidents that happened, and they just kept shoving him off to the side. They didn't even put him in, they did all of his examination right there in the hallway, in these little booths.
So they determined he's not as important as these other.
Yeah, the triage, you get
Crazy.
triaged to the back, yeah. Well, one of the first programs we put in place there was the e-emergency program. I was most excited about that. And they use I think it's in Sioux Falls, South Dakota, if that's still where they're based out of. But these guys, there's a team of emergency room specialized doctors and nurses that are there 24/7. And they have, our hospital has a red button that they push, and we have this, $40,000 worth of technology where those doctors can take a camera and zoom in to all the monitors and observe the patient and give a prescription to our staff. So like say our doctor's not on staff, it's late at night or something, and they're,
Really?
and it's called e-emergency. And so we have access, the hospital here has access to board certified emergency specialists, doctors and nurses that can actually give orders to our staff. So like if you just have a CNA on staff, because you can't keep your doctors there 24/7, or you got a nurse, an RN, they can do anything the doctors say. So when Marge Jorgensen, she was the first person they pushed the button for. She
Wow.
had something with her heart. She said, "Teresa, you saved my life today." I was like, "What?" She goes, "I was the first person to use the emergency." And I didn't have to, she said, and they took me to Billings afterwards, but they decided that they had done everything that they could have done right here. And when we wrote that grant, what was exciting is I found out like the first 60 minutes is critical for survival in emergency situations. And so having local emergency room service where you can get flown to Billings
Yeah.
after you're stabilized saves lives.
Yeah.
So it is really important that our hospital stays open.
I
Really.
agree.
Really, really important. So, and I know several people that wouldn't be here if we didn't have local.
Well, and they're competent, they do a good job, I'm impressed, I even had to have one of those, is it a CT or whatever, right there, brand new
Yeah.
machine,
Exactly.
and it was, they said the imagery was superb, they're like, hey, we know that we don't have this, you don't have that. And it was a huge relief to me.
That was our second project we worked on, was the new CT.
Well, it's
Yeah.
actually, then I've gone to St. Vincent's, and the CT here is not better than the one in St. Vincent's.
We were better than Billings for about 2 months.
Right.
And then they got a new one in
Now
one of the
they're- yeah.
hospitals, but yeah, we were.
Yeah.
But that was 10 years. That was in 15. So they're starting to get to the point where they probably need to start.
They got a new CT, another one.
Oh, they did now.
Mhm.
I was gonna say we were to the point when I left that they needed to start replacing the equipment, and But what's really great is we've been planning, and the board's been doing this, they've been planning, the hospital's been planning for the replacement of the equipment now, so they've been saving for years
They have, yes.
to start doing, capital improvement replacement without having to do all the grant writing and stuff, cause when you get ahead, you can sort of do that kind of stuff.
Yeah, I worked on a huge, first phase of a master plan in Barnes Jewish Hospital and Washington University School of Medicine in St. Louis. And the first phase was a $400 million integration project where they built a ambulance department, a cancer center, and a neurosurgery. And they were like, and they tore down buildings. Anyway, it was a big deal, and the medical equipment budget was enormous.
It's ridiculous.
And then they hired, and we actually had to fire the guys that were supposed to. So the idea is you'd have this new structure built, and they'd have new medical equipment. And so we got into it, and we said, okay, so where are we at with getting the medical equipment ordered? So we haven't ordered any of it. It's like, well, why not? I said, well, because we can't get the doctors to meet with us. And they said, well, where are we? And it turned out the doctors were holding this whole project up because they wouldn't meet on their departmental spaces, and we've solved it. We said, well, you're gonna have to get the head of the hospital and tell the doctors that they have to meet. And, but I remember looking at this, it was like, I can't remember, it was a huge amount of money, the medical equipment. But the people that ordered it were from Chicago, and they were really arrogant. And it's like, it's just not acceptable that you guys waited all this time. We thought you had this equipment coming, and you hadn't done anything.
It takes a lot of time to
Yes,
research
long
those because
lead.
it constantly changes. The technology
It
constantly
does.
changes, and you gotta look at your needs and make your decision. I mean, it was a whole process. I would start making a budget first with the staff, and then you'd have to reshop it once you got it funded because the
Because of the
technology had
technology.
changed. But when I first started working for the hospital, I'd worked for a nonprofit, and they dealt with technology. That was their specialty. And when I was so floored by the cost of healthcare equipment, I said, you know what they do when they price healthcare equipment? They just say, okay, it costs this much money, and then you add a zero. They just round
Yeah.
up. I mean, it is absurd when they find out you work for healthcare. I think they round up some ridiculous
Well,
amount.
and then that's what makes our insurance go up, and
Yeah.
everybody, it's insane.
Cause, yeah, anyway.
No,
We're lucky.
it's good stuff. Anyway, this hospital's, I'm glad to hear they're,
Yeah, and the staff is wonderful. I've heard such good things about, like that.
Yeah,
My
they got
mom
good-
loves the PT staff.
Exactly, they've got good people up there.
Yeah, yeah.
And they do have some local people, they were raised here, and so they
Yeah.
know you, and they don't run around telling everybody how sick you are.
yeah, they're
Yeah.
very close-lipped with the private,
Yeah, they have
personal
to.
identification,
Yep, that's important. You're right.
especially in a small community.
Okay, off to boring stuff.
All right, there we go.
Okay.
So, I don't know if you guys got emailed, but I just saw an email from, the meeting, that spontaneous one meeting we had with SHPO and the EPA guy and
Yeah.
Snowy Mountain. So she got all of everything approved and got the concurrence letter back to Greg in 13 days.
Yeah, we saw that.
See, and that was
Saw
the
that
power of that
yesterday.
meeting you had.
Yeah.
Yeah.
As you made a showstopper a non-showstopper.
So she sent that, and then I don't know. Did Tanya then copy you guys when she asked the loan officer to?
I don't think Tanya did.
Okay.
But I did see Greg's email, and then, so we got the,
So Kirk is their loan officer. Well, looks like she's
Kirk. Well, I did see
Kirk.
something from Greg saying Kirk.
Kirk Kaiser is Snowy Mountain's loan officer.
Oh, I did
And
get it
she
from
said, we
Tanya.
received the documentation we needed from SHPO and have the all clear to move forward to execute so she asked him to execute the Brownsfield cleanup loan for Muscle Shoals County as soon as possible.
Okay.
So, all those documents were ready for like weeks. Wow. So, so you guys should be getting whatever the forms are from Kirk to sign for the loan docs and
Okay.
the sub-grant.
That way they can begin procuring a abatement, you know, whatever they need to do with their toolbox. Okay.
And I do know that Tetra Tech is interested. The fellow that you guys started talking to in Billings, he's interested and he's ready to go.
Yeah.
And he said, "Oh yeah, we'll get that." He said, "I'll come do a walkthrough. We'll get a plan in place,
Good deal.
and then we'll bid it." And I'd say cleanup's gonna. I mean, depending on how long she has to announce that. She said she has to announce it for a couple of weeks or something. So it has to be, you know, legally noticed for so many weeks, so it's competitive. So we're on the move there with Snowy Mountain and the hazmat cleanup. So I guess our next step, I'll just follow up with Tanya sort of maybe Monday.
Yeah, and if we need,
See
if
where we
something's
are.
in our court to sign, I mean, you know, we need to get it on the agenda and we'll get it signed.
Okay, well, I'll follow up with her and just sort of get, okay, what's the time frame now? And,
Yeah.
and maybe ask her to put that in writing so that we all know, okay, here's what we're looking at as far as cleanup. Cause potentially now with the way things are moving with design and with RFQ, we may have enough time to get the cleanup done.
Well, then you think about it, you got 3 parallel paths. You got an RFQ for a contractor to work with the designer, and then you got the developer RFQ, and then we got bringing on board the abatement firm, and ideally, they could all work together. You know, so it's gonna be a challenge.
Well, my biggest goal is to get the majority of the building cleaned up before the
Yeah.
The contractor comes in there and tries to do the
and does
structure.
anything for
Yeah.
the
I
structure.
think that's the smartest move.
Because then we know, at least when they're coming in and out, that people are safer.
Yep.
And then we just have to clean up that corner back there.
Yeah.
So the RFQ, so we got to talk about this, Bob, but I forgot to mention to you guys, when we finalized the RFQ for the developer, the big thing that I still kept sort of nagging at me was the vacant lots. So should we mention that or should we not? Because when I first talked to Randy Hafer about the idea that the mayor had about the vacant lots, he was really immediately against it. Because evidently he, as a developer, he's had a bad experience about having, it's some kind of mixed development with a vacant lot and a building, that creates some other kind of complexity for a developer. But then when he came, you know, he served on the KSU tab board, and when he saw those renderings that Blake had done that had the outdoor space, he immediately said, well, maybe I just need to open my mind and maybe it'll be worth having that complexity. So he changed his mind about that. So I have a call out to, what's his name?
Gary Gordon?
Minock. John
Oh,
Minock.
yeah.
John Mike.
Because I wanted to just hear his perspective as a developer. Do we need to mention this? Would a vacant lot scare a developer off? And we could have, you know, we could sort of, anyway, he texted me on Christmas, actually said, I missed your voicemail. I'll call you next week. So I'm gonna talk to him next week, Monday. And I did follow up with Gary Barta 2 weeks in a row and hadn't heard back from him. And his appraisals were due on the 20th. I asked him how long it would take. So,
I saw your urgent email saying,
Yeah.
you know,
I gave him the exclamation point.
Oh.
But I didn't hear back from him after that, so, and I left him a voice message too, so. I told him, it's urgent in this conversation where we're trying to decide, so the whole point and the question I have for you guys is, when do we bring this idea of the vacant lots to a developer?
Right.
So we don't scare a developer off? Do we put it in the RFQ or do we have a discussion with them?
well, you talked about potentially having an amendment to an RFQ.
Yes.
And I think this is just my thoughts, because Teresa and I kicked this around. you know, there's, strategically, it might make sense for everybody, for us to get those lots if we can get them, and then they're not, you know, but, and Teresa's gonna follow up if there's a downside to that, you know, then maybe, but it will affect the price we get. And so part of what the RFP is gonna do is they're gonna give us a price.
Exactly.
So if we get enough information here, maybe in the next week or so, that we think, yeah, we wanna buy those lots, I think we maybe do an addendum to the RFP, and maybe we give them another week or something, you know. Because I do think that's a key element that, you know, the bottom line is if we get the lots, is it maybe gonna improve the quality of the proposals, what people are gonna do? And will it make, and can we recoup what we pay for those lots in what they're gonna pay us?
Let's,
If-
yeah,
if-
let's
if.
get those appraisals and then we can kind of move forward on that.
Yeah, and that's why I've been sort of nagging Gary, because I feel like it's really critical. And that was the when I checked with the two appraisal companies, I said, how quickly that was my question to him, how quickly can you get us these appraisals back? And he said 30 days.
You already did the appraisals on the building itself, the lot values, so all he needed to do is just move over.
And I already connected him to I did some of his legwork for him, I connected him to the owners,
Yeah,
Okay.
you did.
so, yeah. So it was just
There
that
might
he
be some-
hadn't got the bill, he hadn't got here yet and done his on-site, and that's his first step, and he just hadn't done it yet, so, whatever.
So maybe one of you guys might wanna call him, let him know that, hey,
Oh.
you're holding
Oh,
up
I'd
the deal.
definitely call him.
If you wanna give him a ring and just let him know how critical it is,
Yeah,
because
we got
we've
about a
already,
week to figure out what we
Yeah.
wanna do, otherwise we're gonna, cause we
We've
don't wanna
already-
push that response out too far, you
No.
know, so.
cause our information meeting with the developers is the 14th of January.
Coming up.
And we, just, if he knows, we've already sent out the RFPQ, that's why it's critical, so he knows that, I mean, we gotta make this
Right now,
decision.
it's not in the scope,
It's not,
but it might be a really smart thing to add to the scope if at all, you know. I think my instincts tell me it makes a lot better deal for the developer.
Yeah.
But I'm not sure you'll recoup what you pay for those lots.
especially with what Bruce Bannister had to pay to recoup
Yeah,
those
yeah.
lots. So I guess my question to y'all about the vacant lots are, would you consider just buying one and associating it with Weir? Or-
Yeah, I think, or maybe one or two, or maybe not all three, or one. That's all part of what we need to think about.
Right, so
And
when we
maybe
find
Mike
out,
Teason's, you know,
Yeah.
what's his name?
John,
Minor. His feedback will kind of give you a better feel.
Okay.
Hey there, Gary, this is Mike Turley down here in Roundup. See, we were just talking about your appraisal request here on the Weir building block, and so we're just wondering what, how far you've gotten. Hope to hear from you. We'll be available next week as well, so you take care.
Probably down in the Bahamas.
Yeah, he's probably sorry.
Okay, let's see, last thing I think. Okay, we need to prepare for the information meeting, but it's not till the 14th of January.
Got lots
Like
of time.
what we wanna decide to share with the developers. I haven't had a developer call me, but then wasn't expecting them to call me over Christmas.
Yeah.
I did get KSU Tab's permission to upload those draft documents, cause they didn't meet their deadline of the 20th. Because of all the extra work they did on that survey, I think. But I did talk to her, cause I said, can I just upload the draft documents in case somebody does ask for them, that they'll at least have those, cause I wanted them to have those renderings. And she said, yeah, Teresa, 'cause basically all I have to do is compile them all into one document. I just didn't have a chance to do that, cause she had some questions for me, and so I replied back immediately and gave her the answers.
So what's a KFT?
The KSU Tab,
Oh,
the
okay.
renderings and their market analysis. I think those, guys, I think the decision we made to move that product forward was so good.
Yeah, I thought it would help market the project.
Boy, they did an excellent job. I was impressed with all the little alternatives they had there.
And he did add, a rendering that has like, if you had the vacant lots and you used them this way from an aerial view,
Yeah,
he had like parking, it's just, if you wanted to do a drive-through parking lot there, or do parking along the alley, he really did a good job
Yeah,
with those.
I was impressed with that.
So I think it, I think they're basically a developer comes in and they wanna do a market analysis, they wanna do some visioning, and we've done it for them.
yeah, and that's the power of it. It's like, hey, you got this, hopefully it just jumps out, there's a hell of an opportunity here. You're gonna get a building that's structurally sound, that's abated, it's got a new roof, energy efficient roof, and you're maybe gonna have these lots available, and you got these ideas from this. I don't know, I think it's good
Yeah.
stuff.
I think we did good, so I did put those, so I got her permission to put the draft documents in our cloud folder that we'd share with the developer, but she said, Teresa, as soon as I get back from vacation, which is the 2nd or 3rd, she said, I'll get that final document to you guys, and then I'll disseminate it to everybody, the advisory board, and then upload the final documents, so. And I'm really not gonna reach out to the developers that have expressed interest to me until that's done.
Okay,
And then maybe that'll buy us some time to make some decisions about the vacant lot. Cause if I haven't disseminated, if we haven't given the RFP packet to anyone, then we don't have to do an amendment. I can just fix the original.
yeah. The one thing that I thought was really good, how we went over the RFP and how we were gonna weight everything, I thought that was a really powerful work session here. But there's one element, that we need to be thinking about on the side, is what that contract's gonna look like,
Mm-hmm.
And maybe because that's what I thought was gonna take all the time, is to decipher what Silverbow did or whatever, where they actually said, we'll take the property back if you don't meet certain milestones.
Mhm.
We don't need to know that now. We've laid it out in the RFP. The time is really, we're gonna listen to what they tell us their timeline is and what their plans are. And then maybe we tailor it after that. But I think there may be real power in understanding what Silverbow did and how they held the developer to those, basically doing what they say they're gonna do.
And Karen with Butte did share those development agreements. I think I have 2 or 3 from her.
And I think I saved them too. She sent them, a
Yeah.
bunch of information.
Like
You might
back
even
in-
have uploaded them, I don't know.
No, I didn't upload them. I did save them for us. And I thought if it's okay with you guys, maybe in January I'll start working on like a draft development agreement. And the Billings folks that did that yesteryear's one that I tailored the majority of our RFP after, she said she highly recommended that we get the development agreement that they used on that project.
Okay.
Because she actually got it from Ohio, whatever community that they got it from. She said it was so good what they're doing that we just borrowed
Okay.
their development agreement. So I'll probably just get theirs and then sort of add what you gave us to it and customize it for our project and,
Yeah, the other is kind of, it'll all be tempered by what these developers put in their response,
Mhm.
But I think this is an opportunity to learn a little bit more, this is good stuff.
okay, well, and then maybe once we hear back from, the last thing is I was thinking about raising more money. But I think it's, I don't know. I'd like to know what we need.
Well,
Yeah.
you see, I'll update, last time I ran the numbers based on 185 that we got, and what you got from the Main Street, and what we got, the 50,000. And then the estimate that we had for everything else, my sort of estimate. We were $55,000 over the $600,000 out-of-pocket mark. So, in theory, we would need another 55 grand. but obviously, the more we get, the better.
Yeah, my goal was to not use your whole maximum.
Yeah,
I
that's my
really
point,
wanted
though.
it. So, but the thing is we sort of still don't know what
We don't know what we're
structural is gonna cost us.
We don't know what we're gonna sell it for, we don't know, I don't have the
Yeah.
lots in there, all these variables, but this is what I found, and
You're getting closer though.
it is, you know, I used to estimate a lot of jobs. There's a phenomenon called balancing of errors.
Mm.
If you make an honest effort to put what you think is reasonable down and you've covered the scope of your project, you're gonna be high somewhere, you're gonna be low somewhere.
And it works out.
And it usually works out. It's when you try and short that effort, you give it sort of a weak effort, and you got, and I think we've identified all the elements. We've got like a $400,000 figure in there for the structural repair. We don't know, you know, but we do know there's only so many weeks that they think it's gonna take, and how, of course, what I was gonna say, well, how much money you can spend in 5 weeks? Well, hell, you can spend. We found that out. But anyway, so I think I'm still confident. You know, and then the idea is, let's say you throw the lots in, and let's say the lots are 60 grand, you know? Well, is the developer gonna say, you know, like, I'll give you 250 for the building and another 60? You know? So those are those variables that are all sitting there, that are out there. I know I'm beating it to death, but we're getting closer, like Mike said.
We start getting into the red, we're just gonna deed it
We're
to
gonna
Mike
have
Hoffman.
that face there.
Well, we're waiting for Mike to open his checkbook.
So,
He's got so much money. Yeah.
so there is that, we had this meeting months ago, with the USDA Rural Development Business Grant. And there is, I'd like to sort of follow up with them and gather a little bit more information, but, municipalities are eligible for economic development projects to apply for this grant. And it is a grant, it's not a loan. But, you know, the USDA has quite an elaborate process that you have to go through. So there's that expense on applying for it, but if we're eligible, it may be worth sort of buffering the cost of the county. I'm gonna make just a couple phone calls and just sort of gather some
Feel it
information to
So
be
to
sure.
gauge the effort versus the likelihood of success and all
Yes.
that kind of stuff.
And be sure our project's eligible with us, just wanting to own it for, you know, 4 or 5 more months and then sell it. So I've just gotta be sure that would be an eligible project. And then, but it sounds like from what I've read on their website that it is, and from our meeting that it is, but, I'll verify that. So that may be an option that the county may be interested in, or going to Parker.
I
And just
think you're still gonna want